experts, and we have the experts today. You know, here in Barrett County, diabetes is definitely a big problem. That's why we want to talk about it with you today. Please welcome Dr. John J. Gonzalez. He is with Texas Center for Medical and Surgical Weight Loss. How are you, Dr. Gonzalez?
Doing well. Thank you very much.
Very happy to have you here. So Barrett County has a very significant, alarming rate when it comes to diabetes. Why is that alarming?
Well, it's alarming because diabetes is it's a terrible disease, and it affects virtually every system in your body: kidneys, heart, peripheral vascular. The problem is in San Antonio, and actually in the United States, period, it's associated with being overweight, being obese. Sure. When we look at the statistics now, especially in Barrett County and South Texas, it's startling. I mean, you're talking about, and nationwide even, 40% of the citizens are considered pre-diabetic, not to mention the ones that already are. Right. But it's a true epidemic here in South Texas. And
that's really scary. Even when we look at our own families, we know we have those family members that we just want to say, I want you to go see the doctor. Now, let's talk a little bit about what you do, because surgery to treat this is not like it used to be. It's changed. It's effective and it's easy. Tell me a little bit about what you do over at the Texas Center for Medical and Surgical Weight Loss.
Well, obviously we do weight loss surgery, and you're right. I mean, surgery is scary. I mean, I wouldn't want to have surgery just for giggles. But the fact of the matter is nowadays surgery is a lot safer than it used to be. And now we do it minimally invasive. Back in the old days, they used to do surgery by splitting you open from stem to stern.
Oh, yeah.
And it was a big incision. It was a big recovery. Now we do them through itty-bitty tiny incisions. Oftentimes the width of my pinky is all it takes for us to do these complex surgeries. The recovery's a lot quicker. The hospital stays a lot shorter. Pain's a lot easier.
Right, but the gain in the end is tremendous, because you're going to change your life. You're probably going to add years to your life. You're going to be healthier, and this is just something that if you've been putting off, you need to get done now before it's too late. Now, I know that you brought this, and tell me a little bit about what this does.
So this is one of the surgical staplers we use, and basically with this one instrument, we can do 90% of the surgery that we're doing. And the whole point of this is to lay 3 layers of staples on each side of the incision we're making, and then cutting it in the center. So at no point are we ever leaving any of the organ open.
Right. So it's not like back in the day. I mean, this is all it takes, and you're going to get that surgery that a lot of people need.
No, they absolutely need it. And we can put diabetes into remission, virtually cure it.
Right.
It's shocking that insurance companies aren't begging me to do this, so that our seminars aren't filled with people saying, hey, please cure me of this disease, because we can virtually cure you, put it into remission.
That is amazing that you say that, because you can cure diabetes. You can take charge of your life and live healthier. Now, tell me a little bit about what happens when you've seen patients, they decide to take the step, they do the surgeries, and they're on to a better life. What does that mean for them?
Well, it's life-changing, obviously. And when you see, I mean, oftentimes these patients will leave the hospital off their diabetes medications. Before they've even lost a single pound, oftentimes their sugars have been normalized just by the nature of the surgery that we're doing. And it's not just diabetes. I mean, we're taking care of blood pressure, cholesterol, obstructive sleep apnea. It's limitless, really, the things that we can do. And when they come in, you see how happy they are. They're off their medications. They're doing things they haven't done in 10 years. They have more energy than they have. They're running around with their kids. It's awesome for us. It's life-changing for them and incredible for us.
I would imagine it just adds so much more, even when it comes to daily activity. You're just going to feel like a new person.
Yeah, it's the activities of daily living that we all take for granted that for the obese patient is a pain. Tying your shoes, walking up a flight of stairs. We take that for granted, but it's real irritating when you're overweight. And those are the kind of things that really bring people in. They're tired of their activities of daily living being suffering.
And that's perfectly understandable. Now, who is a candidate to come see you and to get a surgery done?
Well, for us, we follow the National Institute of Health guidelines, and that's what your insurance company will follow too. Anyone with a BMI of 35 or greater, a body mass index of 35 or greater, and to give you some perspective, to have a body mass index of 35, if you are, let's say, average height, 5'4", 5'5", we're talking about 205 to 210 pounds. So not 400 pounds, 205 pounds, you're a candidate if you have diabetes, blood pressure problems, cholesterol, things like that.
Got it. Now, and you doctors are the ones to trust. You've been here with over 30 years combined. That is tremendous surgical experience. Now, you also offer the latest technology. It's a win-win, guys. I also want to express that you have an app that actually follows patients after their surgery. I think this is amazing.
Yeah, it's great, and they like to. It's satisfying to see where you've come from to where you end up for everybody involved, especially the patient.
Okay, now I do want to tell you guys that they have great offers going on. They have free insurance verification. They're offering it to callers when you contact the office. Give them a call today, 651-0303. Ask to speak to Deanna. She's going to take care of you. They have all kinds of financing options ready for you to take care of yourself and start living healthy. Let me give you some info. Texas Center for Medical and Surgical Weight Loss. They're at Northeast Baptist Hospital, 8811 Village Drive, Suite 300. Call them, 651-0303. For more, look for them on Facebook, Texas Bariatric, or Twitter at TX Bariatric. Thank you, Dr. Gonzalez.
Thanks a lot.